What are orthobiologic and regenerative treatments?
Orthobiologic treatments are divided by the word ortho, bone, biology, human tissue. And how that works is any human tissue that we could extract from the human, re-inject back into the human using its properties of healing, anti-inflammatory, and regenerative and reproduction of cells within the new part of the body from the same host. Regenerative treatments are treatments that essentially regenerate or increase the function and anti-inflammatory properties of products that are produced from the human body within the human body. For example, PRP, which is platelet-rich plasma, or adipose tissue, fat tissue, stem cells, or stem cells derived from bone marrow or bone marrow-driven stem cells. Those are some, but not all, of the products that are usable in regenerative medicine.
What treatments does Celaxys offer?
Here at Celaxis, we offer full spectrum ability of regenerative medicine and stem cell therapies. This includes platelet-rich plasma, PRP, bone marrow transplant, adipose, which is fat tissue transplant and stem cells, as well as placenta and umbilical cord treatments and injections. Even though we provide all of the above, we really focus on autologous, which means comes from your own body. The reason for that is we like to use your own tissue that has a regenerative power to make you heal without rejections, without getting quality issues, by getting frozen material from the outside world that we don't know how it's going to impact our patients. However, we do offer all.
What's the procedure downtime?
The downtime of procedures are dependent, obviously, on the procedure that we do. Most PRPs, platelet-rich plasma treatments that are in the joint, in the tendons, in the muscle, usually take 24 to 48 hours for recovery time, sometimes a little longer if it's a large dose or super concentrated PRP within the joints. But the recovery time is significantly less than when we do the bone marrow or adipose-driven stem cells. The adipose and bone marrow-driven stem cells usually take about 4 to 5 days for recovery, for pain. However, the recovery and the full range of motion and recovery back to normal is patient-dependent, anywhere from 2 to 6 weeks. And just to generalize, we just say 4 weeks. I have had patients that are back to 100% activity, normal activity within 10 days. We like to prolong that a little bit and let the mesenchymal stem cells, which are the stem cells that actually produce new tissue, to be able to have some downtime to actually start the production of the new cells where they sit on the tissue itself. So really 4 to 6 weeks is where we want to be.
How is PRP obtained?
We obtain the PRP, platelet-rich plasma, from the blood. It's usually from the antecubital fossa, which is right in the forearm, where a lot of people get blood from. And we use the blood and put it through our systems and our machines and centrifuges to be able to extract the plasma. That is a significant amount of platelets, that has a significant amount of healing and regenerative power.
How are stem cells obtained?
Here at Celaxis, we focus on autologous stem cells, meaning coming from your own body. We have 2 types of autologous stem cells that we use here: adipose tissue, which is fat, and bone marrow, which is inside your bones and the marrow of your bone. We obtain the adipose tissue with a mini liposuction Essentially, the process is that the patient comes in. It's usually a 2-hour process. They come in, they get checked in, they go to our operating room. We usually have an anesthesiologist or an anesthesia team here that will give you light sedation. So you're not fully sedated, you're not intubated, there's no tube down your throat, but you will not remember any of the part of the procedure. We do a liposuction, 2 operators usually. We extract the fat on the subcutaneous tissue right below the skin. We take the fat out. This is not similar to plastic surgery because we want to get the nice big size adipose fat tissues out. Then we put it through one of our machines that extracts the right size adipose fat tissue that has the embryonic stem cells in it, mesenchymal stem cells. Then it goes through our centrifuge and we extract out the most pure form of the embryonic mesenchymal tissue, which has the ability to regenerate and produce new tissue on wherever we place it. The bone marrow extraction has the similar check-in, similar anesthesia team, except instead of going to the adipose, the fat tissue, the patient's sleeping on their belly, which is a prone position. And we usually like to go on the iliac crest, which is the top part of your pelvis. We put some numbing medicine in. We go with a device called a trocar, and we extract about 60 cc's of bone marrow. And then the bone marrow goes through a special kit, and we extract that out. And then it goes through our centrifuge process, where we again extract out the mesenchymal stem cells out of the bone marrow. Usually we like to use bone marrow for all of our spine cases.
How painful are the stem cell procedures?
Stem cell procedures are not painful at all because we have a full-on anesthesia team that will make sure that patient has full comfort. The only pain within this procedure would actually be the poking of the IV or the blood where the anesthetic goes in, and that's for the most part. Or if the patient's awake, if we're doing a larger joint, for example, like a knee, but it's no different than doing any other joint injection. The extraction of the adipose fat or the bone marrow is essentially pain-free. Patient will be under anesthesia and won't remember any of the pain. The pain level after the procedure obviously is different on the procedure that we're doing. If we're doing a ligament, tendon, muscle, PRP, again, there's a level of discomfort for 24 to 48 hours. It's not significant. As far as the larger joint injections, some level of discomfort within the large joints for the first 24 to 72 hours. By the 5th day, they usually resolve. The spine procedures, if we go in the disc, which is the disc space between the spine joints, that could be painful for the first 2 or 3 days. And obviously we give patients narcotics. We usually like to do our procedures on Thursdays so they can rest Friday, Saturday, Sunday. We're available all weekend and we follow up on our patients. But there is some level of pain with the disc injections. The facet joints, which are the joints in the back that is not the disc or any of the epidural space, has minimal pain levels, and I would say maybe for 48 hours or so. The incisions where we go for a bone marrow or the liposuction has minimal pain. They might be a little sore for a day or two, but after that, or have some ecchymosis, which is discoloring of the skin, but after 24 to 40 hours, there should be no pain.
How long do stem cell procedures take?
Stem cell procedures of any type should take no more than 2 hours. The reason is that we want to keep these cells alive, healthy, and back in your body as soon as possible. Our record on knee transplant are approximately 22 minutes. Some take longer, some take less, but from the time that we actually extract the bone marrow or adipose, we want to have it within your body as soon as possible. The entire process should take no more than 2 hours from check-in time to checkout time. We're very efficient. Our lab is right next to us. Patients don't leave the facility. It's the same day, 2 hours, in, out. All of the patient's autologous products will be injected in them and out within 2 hours. Our facilities here are the state-of-the-art. They're Joint Commission approved, which is the same as a hospital level. JCO accreditation. We have board-certified anesthesiologists. Our interventional spine specialist is a Harvard-trained spine specialist that oversees our spine program. And all of our physicians here are board-certified.
What's the post-op care?
Post-op care for regenerative medicine is obviously dependent on the procedure. The PRP post-op care is minimal. Again, it'll be sore for 24 to 48 hours, normal range of motion. We usually don't want the patients to do any heavy lifting for 3 or 4 days. As far as the bone marrow extraction and spine injections, post-op first 3 or 4 days are going to be painful, but after that, the patient starts recovering. I really like our patients to be very mellow for the first day or two, and then increase movement and daily function as tolerated. Physical therapy is now, we're changing our position on physical therapy. We used to like them to start 4 to 6 weeks out. Now we have our patients start 10 days out, physical therapy with a slow progression. And within 4 weeks, we like the patient to be on full activity, full physical therapy, muscle strength, and pressuring the joints with increasing muscle mass. As far as the adipose tissue, the recovery on adipose tissue, which is the liposuction, is very minimal. Again, 3-4 days back to normal activity. As far as eating, sleeping, laying, none of those issues. As far as the joints are involved, again, every patient is different, but for the most part, minimal activity for the first 2 days, then progress as needed. And by the 10th day, we want the patients to be back in physical therapy with a slow progression and 4 to 6 weeks on full range of motion and activity.
Does my insurance cover regenerative procedures?
Unfortunately, insurance doesn't cover regenerative medicine. PRP, stem cells, umbilical cord, autologous from your own body, none of that is covered. However, here at Celaxis, we try to accommodate all of our patients. We have different programs that our patients can apply for, and hopefully we'll be able to provide this amazing procedure to all of our patients at any socioeconomic class. Regenerative medicine is not covered by insurance in this country. Some countries in Europe do cover some or all of the stem cell procedures. However, the reason that in the US it hasn't been covered is mainly because cost efficiencies and the idea that most spine patients, for example, 98% of spine patients would rather not have spine surgery. And the cost of the 2% spine surgeries is significantly less than what I would assume 100% of the people that have spine issues would undergo regenerative stem cell therapy. And that's why I believe that the US has been delayed in covering this healthcare. Also, the FDA is not approving a lot of these cases. However, the stuff that we do here, mainly the bone marrow, is approved under FDA, even though it's investigational. Insurance companies are for-profit companies, and that's what it comes down to, why there is no coverage.
How much do regenerative procedures cost?
The cost of stem cell procedures obviously dependent on the procedure itself. Most other companies that we're aware of are costing anywhere from a few $100s to $20,000 to $30,000. Here at Celaxis, we range about $600 to $700 up to $8,000 or $10,000. However, we have different programs that allows you to make payments with a smaller down payment, and also a care plan that patients can apply for. Our goal and our mission is to touch and heal as many patients as possible with their own healing abilities. So we make this procedure accessible to everybody at any socioeconomic class.
How long do regenerative procedures last?
Stem cell procedures last depending on what the procedure is. PRP in the tendons, ligaments, or an acute injury could last forever. PRP in arthritic joints could last anywhere from 3 months to 1 year. Stem cell procedures that are adipose driven, which is from the fat, or bone marrow, last 3 to 7 years with a significant efficacy of 82 to 86% according to our outcomes here. And some of our patients come back prophylactically every 3-4 years just to get the injections done because they don't want to have any issues. And some patients come back within 5 or 6 years. But historically, we only see 10 or 20% of our patients come back within 5 years.
Can stem cell procedures be done as preventative?
Stem cell procedures can be and are being done preventatively. I have a lot of patients that had an initial stem cell procedure that come back every 3 years. A lot of our athletes come back regularly, preventatively, to get stem cells, adipose, bone marrow, PRPs. So yes, the answer is absolutely. I have had PRPs done on me. I've had bone marrow stem cells done on my spine 14 months ago. I actually had a full-on foot drop and severe pain on my left side with a surgical diagnosis. However, we did the largest stem cell procedure on my spine here, and 14 months out, I'm approximately 95% improved.
How effective are stem cell procedures?
The efficacy of the stem cell procedures, again, it depends on the procedure itself. However, if it's an acute issue with a PRP in the tendon or ligament, it could be one-time deal and no more issues after that. If it's a recurrent issue, then patients can come back and we'll inject them multiple times with PRP. We have a lot of athletes that do that. The stem cell procedures usually last 3 to 7 years, depending on the severity of the disease process. The efficacy of the PRP and stem cells are obviously different depending on the procedure, but for the most part, our average joint arthritic patient has an 82 to 86% resolution for a 3 to 5 year period.
What makes Cellaxys stand out?
What makes Celaxis unique in the country and in the world is we are one of the few centers that has the operating room and the laboratory and our offices all in the same spot. So there is no downtime. Patients here, we check them in, we get under anesthesia, we get the product and the stem cells out, we take it to our labs, back in the operating room, under fluoroscopy if need be, which is a very, very high-end X-ray machine that enables us to get our needles within 1 millimeter of the exact point of intrusion and transplant. This is rare and hard to come by, and we are proud of what we can offer to our patients.